Well, thank you very much. A remarkable thing, we said the panel would finish introducing itself at 5:40. So we've got plenty of time for questions, and I hope you've all got lots of questions. I just want to start with one, and I'll address it to you, Josh, to start, and then we'll see the rest of the panel. It seems to me that one of the critical issues here is how we slow down the spread, how our behaviour slows down what might happen. And can I just ask the panel, starting with you, Josh, why that is so important?
Yeah, sorry, one of these. This is the fundamental strategy, really, here at the moment. It's going to be a while before a vaccine comes on board. So every one of us are a little bit vulnerable to becoming infected. And for most of us, it'll just be a simple, it'll be a mild infection for the vast majority of us, okay? But the big issue here, even though this may in many ways be a bit like influenza, spreads like influenza, and may cause an illness that in a lot of people is quite similar, or even some people milder, the issue here is about everybody becoming ill at once. And even if a very, very small percentage of the population need hospital care or ICU care, if that happens to everybody at once, that's an enormous burden on the health care system. It becomes overwhelmed. So what you need to do is, the idea is to slow down spread so the healthcare system can cope at any one time. It's not overburdened. And that's a bit hard because you've got to have a bit of endurance, because it means that things may go on for longer and stretch out for longer. But that's the way the healthcare system is going to cope, and we all play a role in that. I think but other people will enlarge on that. I think I've kind of got the ball rolling.
I'm just going to add to that, because while that's happening, everything that normally happens in the healthcare system is happening as well. So a lot of that work doesn't go away. We have got the ability to cancel some elective work, but a lot of our work is acute. And so all the usual things that are coming into hospital every day keep coming, and so we need to manage that as well. And so slowing down that kind of transmission and that requirement for high-level care in the hospital system is absolutely critical to how we manage this pandemic.
Any other comments? Can I just ask one more question, and then we'll open it up to the audience? Is this real? There's still a lot of people in this country who think we're making a big fuss about something that is not going to have a huge impact. Just like your comments, maybe starting with you, David, how real is the challenge we're facing?
How real the challenge or how real is the disease?
Both.
Yeah, I think there's no question about the disease. I think it's, we've seen other outbreaks. I think the numbers here are much higher than we've seen other. There's no question. And the reports all around the world are compelling, and we're keeping up to date with them. So there's no question about the disease.
Anyone else like to make a comment on that?
Simply make a comment that clearly the disease is real. But let's say we were wrong, and we are all overstating and overestimating the seriousness. The worst that could happen is that we all wash our hands really well, don't go to work when we're ill, and do all the things that we should be doing anyway. So it kind of seems like a pretty straightforward bet, I would say.
Thanks, Ben. Okay, do we have some questions from the audience? Yep, plenty. And if you could just ask your question as loudly as you can. If the panel can't hear you or the rest of the audience can't hear you, I'll repeat the question. So starting here.
My concern is for the first responder. There will be a number of people at home, I imagine, who, if they get the disease or think they've got disease, will self-impose their movement, their isolation. My concern is for the A&E departments and the GPs, where someone thinks, I think I've got the disease, I'm now going to find out if I have got it. And they then go to the GP's waiting room, the A&E waiting room, and as far as I remember, there's no protection for people when they go in there.
So concern about the welfare of the first responders. Ben, do you want to start that off?
Yeah, thanks, Peter. It's a really good point, and it's one that we've been very cognizant of as the planning's gone on for this. And there's been very, very strong and clear messaging. And I should reiterate it now that if you find yourself in the position that you've just outlined, then it's extremely important that you phone ahead and talk to the practice and explain why you think you need to be seen, and that you think there's a risk that you might have the condition. And in that way, we can make sure that we put in place the plans that all practices have now for safely and effectively assessing patients in that position. So I think we can manage that, but we need help in doing so by encouraging people to phone ahead.
Any other comments from any other members of the panel on that point? No? Next question, right over the back there. Yep, you.
Actually, I got quite a lot of questions.
Just one will do.
Okay. Actually, I'm from Wuhan, and all my parents they are in Wuhan, and the procedures in Wuhan are really draconian comparing the lenient way here. And don't put my face here. I don't want to get in trouble. If we don't wear the mask in Wuhan, the police will put you in prison or isolated you. But here we can't buy a mask in any shop. So is wearing the shop so necessary? And the second one is, for example, all the data you got is from Johns Hopkins, but the Chinese government refused the CDC in America to go into Wuhan for the first month of quarantine. So how can Hopkins get the real data?
That's what you're there for, panel.
I think there's an earlier one about probably about PPE that maybe someone else may want to address. But in terms of the data, you're absolutely right. There are many data sources, and I think we're all aware of that. And the question how accurate all those data are, and that is correct. Johns Hopkins is just one, but I think we've had the reports of the party that went into China, the various information that's coming out. I mean, even with information that's not completely accurate, I think we're getting a picture of what's happening. And so, yes, we are aware of the data arriving so quickly, how accurate all of that data is, and the differences between the different definitions of what is the case and what isn't the case. Some places where the information may be slow in coming out or not come out at all. But what we do know in the practice we call epidemiology, which is studying the patterns of disease, is that actually even when you get, with big numbers like we're getting, even little inaccuracies, we still get the message. And so we can still plan, we can still model. But believe me, there's a great awareness of the quality of those data. Now I think, does anyone want to answer about supplies of personal protective equipment?
Well, I think what I will address is just the utility of masks in public. Now, they may have some role for someone who is ill and for some reason has to be someone who has symptoms, but for people who don't have symptoms, they're not thought to play an important role in most settings. Okay, so that's not a key message. So that's a little bit different from what you might be, the impression you might have got by seeing what's happening in China. And I agree with David's comments. I think the WHO mission in their report that's just gone in there, they did have quite a good look, and I totally acknowledge the issues you've raised, but I think we are getting that picture, as David said.
Thank you. Any other panel members? No? I will take more questions, and I will bring the microphone to people so we get some clarity. I'll come to you in a minute. Here first.
Hi. I'm really concerned about our older population. I think it's very clear that they're the most vulnerable with this disease, and I have older parents as well, so I'm very concerned about them. I'm just wondering if it does, reach the level where it's, relatively, it's in the community to some degree that's transmitting. What we can do for our parents. I mean, for instance, is it a good idea if they've got frail health that they should be going to somewhere like a supermarket where everybody goes, whether they're sick or not, to go get their groceries, you know, and you put, is it likely to be transmitted in that kind of environment? Or, you know, what are some of the practical things that we can do to help our older people?
Who'd like to start there?
Perhaps I could start off just by talking a little bit about how it's spread. Then maybe that's a little background, and then maybe Ramon and others can talk a little bit more about the specific questions. So it's spread much the same way as flu. So you need to be actually up pretty close to someone generally to get this, and it's spread by what we call droplets. So it's not airborne, it doesn't drift out and drift to the back of the room here. If I was infected, even if I was coughing, sitting here coughing away, you know, people up the back of the room, but, you know, would be at risk. Okay, so that's the first thing to keep in mind. Just understand there's nothing particularly mysterious about the way this virus spreads. It spreads just like flu, which we're all really used to. So it's droplets, and also I could cough on that table, and then Ben, maybe if he was sort of touching that, and then like, it's really hard not to touch your face, but you know, rubbed his eye or something, or you know, inoculate the side of his glass and then drunk. You know, may inoculate from a surface as well. So you can get perhaps off surfaces or direct contact with people. So that has to be quite close contact. So that's a bit of background, but I think you're interested in a more specific question about your elderly parents.
We're worried about the elderly as well. So clearly they're one of the most vulnerable groups, and the data out of China does show that the kind of the more serious infections.
Just hold the mic a wee bit closer.
Hold it closer. So the mortality, the more rate of more serious infections, and the mortality rate goes up with each kind of age increment. But it comes back to the same public health messaging. So that kind of good personal hygiene, that protection of vulnerable patients is achieved by people who are ill staying away from them. It may be that they need people to fetch and carry for them and help support them. And avoiding visitors, so who might potentially be infected. So we're working with rest homes, the residential care facilities, regarding putting some messaging out regarding visitors. So people who have travelled to high-risk countries need to stay away from visiting their elderly relatives or friends for that 2 week. That's all part of that self-isolation. And that way we can try and kind of protect them as much as we can.
Yes, I would only reiterate what Sarah has said, and also what I said earlier on about obviously for families, you know who your vulnerable ones are, but also in neighbourhoods as well, close neighbourhoods, there may be elderly there who may need, as Sarah has indicated, some really practical things there, you know, to keep away visitors who are unwell, or if people need to get their groceries delivered, just keeping an eye on people. So it really is the community getting around those who are vulnerable. With family, that's great. You've already identified your parents, and how you work with your family around supporting and protecting them is really vital. And so I think the simple public health messages and those simple things that David said right from the outset, that simple list, is powerful when we do it together.
I would add one thing. This, more than ever, this is the season to get your influenza vaccination. And it's not because influenza is a different infection. It's not that the vaccine is effective against COVID. We don't think it is. It's just that we have an influenza season coming. We know it comes every year. We don't know exactly when, but the concern is that it can potentially happen. This outbreak could merge into the influenza season. We don't know what that really means, but clearly having the influenza vaccine will help protect.
There's been some talk, just before we move on to our next question, about moving vulnerable people to safe havens. Has that got any merit at all? Sending them all to Waiheke Island or North?
I would want that. Qualified. I think certainly I think in theory there is, but I don't know that I've ever. No, it's probably too young. I haven't actually seen it done here in New Zealand before, and I'm not aware of any plans to do as such. It kind of makes sense, doesn't it, if you sequester away those who are more vulnerable, but the logistics of that, and also the psychological impact of that may be, and the a whole bunch of implications of undertaking something like that far likely outweigh the practicality of it, I'd suggest.
Okay, thank you. Other question?
Is there any knowledge on the fact that if you're not symptomatic, that you can actually pass it on to somebody else? Because to me that's more frightening. Like, I might know I've got it, so I'm out in the community and what have you, and all of a sudden there's 10 people of my friends have all got it. And it looks back at one, you can actually tell one person, but I didn't have any symptoms. So,
That's a great question. It's the one we've always asked and wanted to get information on. And actually the picture at the moment is probably good news in that regard, and the fact that it seems that the transmission occurs among people who do have symptoms. And that if there is, and I think we all suspect there will be some people who have very, very mild symptoms or maybe no symptoms who can transmit, but that's the current evidence would point to that's not a major problem. And that's really, really good news, because it actually makes our ability to control it much better, because what we can do is we can identify those people at greatest risk of transmitting it, those with symptoms, and then isolate and react as needed. And that's a big difference from influenza, when we know that there are a lot of people who have very little or no symptoms who can transmit.
but that's based on honesty, and honesty is us that say the border. Now, if you want to get into New Zealand, you're not going to say that you've got any symptoms, are you? And sometimes it might, and you might be to one of those countries, but you come in via some other country. So they don't have the same.
Question is, how do we compensate for a lack of honesty?
Yeah.
That's a tough question. But I mean, we do acknowledge that there's nothing that's perfect, and I think obviously we're reliant on people being honest here, and that extends to, being unwell and staying home. Acknowledging you're unwell and staying home. It's really, really important.
Right, these questions are coming along really nicely. I hope we get some on the capacity of our hospitals, and I hope we get some on children and our interface with them. I'm going to come right across here.
Peter, before we go to the next question, just in response to that, at the border, we've been doing a lot of things. So we've been at the border, we've had clinical staff at the border, we have worked with our border agencies behind the primary line, so with Customs, Immigration and MPI. And there's also this entity called ITOC, which is Integrated Targeting Operational Centre. They do pick up passengers who are flying into New Zealand who have come from countries of origin that are currently countries of concern. So that process has been happening for a number of weeks now. I know that people still get through, but in terms of what we've been trying to do at the border, identifying those who might have a cough or a cold or a runny nose, I think that that is not a perfect activity by any means. It has got holes in it, but I think that has been as comprehensive as our resources have been enabled us to do.
Thank you, Ramon.
Kia ora koutou, ngā mihi nui kia koutou. I'd just like to ask Sarah a question around the psychological aspects of this for our tamariki. And in particular thinking, well, we're just about 5 weeks out from the school holidays, and I'm sure there are many families planning holidays or schools planning school trips that may be being cancelled, or they're thinking about cancelling those. And what impact that might have for our tamariki, whether they might feel guilty about that or that they've caused it in some way. So just that forward planning now as we lead up to the holidays is quite a critical time for decision makers. And I just wondered if you had any comments around that. Kia ora.
Kia ora, Gail. So I think there were two parts to that question. First of all, thinking about, I guess, coping with disappointment, perhaps, in terms of the disruptions on fun things that families might have planned. And the second part of the question, what was that around?
Mainly that first one, around coping with disappointment.
Yeah, I think, I guess it's within the normal limits of stress that kids would experience on a day-to-day basis. And I say that because, I mean, we've all had to cancel plans due to tummy bugs or things happening, and it is really disappointing for kids, and it is hard. And I think that letting them feel disappointed, you know, they are, you know, most kids will feel quite disappointed, and that's okay. Letting them be upset, acknowledging them, validating them, and actually talking with them, maybe let's make a plan to do something else fun instead, and it'll be a deferment to later. And actually, I think, you know, like we all experience pleasant and unpleasant emotions, and that's okay. It's not necessarily harmful to kids' psychological development at all. You spoke a little bit about the feelings of guilt. I think that's a good point, in that some kids and some teenagers might feel more worried. There'll be a lot of kids who are really worried about their older family members. And I think listening to what they're thinking and what they're feeling first before we jump in and reassure or give them more information, finding out what it is from their perspective that they're worrying about, is a good first step.